ways to build your practice or connect with more of your ideal patients? Perhaps you're already busy but need ways to simplify or level up your practice management. Whatever your needs, we've got you covered. Introducing My Appointments, a revolutionary all-in-one practice management solution that will stimulate practice growth, reduce administrative burdens, decrease running costs, and help you build and manage your ideal practice. With multiple inbuilt services including appointment keeping, payment processing, online rebates, product management, customizable online intake forms, two-way SMS, marketing, video consultations, and secure client records, My Appointments has everything you need in one user-friendly place. Our integrated online payment gateway and instant high caps processing will help you stay on top of your invoicing with no setup or monthly fees or the need for a terminal. Our free practitioner app helps you manage your practice while on the go, including processing payments, taking treatment notes, or booking appointments no matter where you are. From their app, clients can also keep track of upcoming appointments and pay invoices, view prescribed products and treatment recommendations, as well as book appointments 24/7. By simplifying practice management, My Appointments will help your business thrive so you can focus on what you do best, treating your clients. Unlike other platforms that charge hundreds of dollars per month, My Appointments is free. No ongoing or upfront fees. Simply pay for what you use. Our competitively priced paid features include SMS starting from 11 cents per message, video consultations from just 33 cents, and payment processing 1.5 plus 25 cents per transaction. No hidden costs and no other fees. By delivering simplified business and marketing solutions and connecting more clients to practitioners, we can help you maximize the potential of your business. Our goal is to support the wider complementary medicine and natural health community and help strengthen business viability and longevity. That's why we're committed to donating 10% of profits to build a fighting fund to help safeguard the future of natural therapies. Your success is our success. My Appointments, by practitioners, for practitioners.
Welcome everyone. Thank you for joining us tonight. We're so excited to be giving you this little sneak peek of the platform we've been working on for the last couple of years. I'm Claudia Franceschini, co-founder and creative director of the My Appointments platform. A little bit about me. My background is 25 years of experience in sales, marketing, and art direction. I'm also a very avid user of many forms of natural health for both myself and my family. For the last 3 years, Anil and I have been working with the natural health advocacy platform, Your Health, Your Choice. And during that time, we've been working very closely with practitioners, and we would often have conversations about how great it would be to be able to streamline everything into one place for both natural health practitioners and their clients. This is where the idea for the My Appointments platform came from. So we took our idea to Complementary Medicines Australia, who also saw the merit in our vision, and we've now joined forces to make this happen. My business partner has a background as a myotherapist, among other things. And so with her understanding of running a practice and my perspective as a client, we believe we've created something pretty special. I'll pass you over to Anil now. She's going to walk you through what we've created. We value your feedback and we'd love to hear your thoughts at the end. We've allowed some time for Q&A, so don't be shy, pop any questions or feedback you might have into the chat, and we look forward to hearing what you have to say a little bit later. I'll pass you over to Anil now.
Wonderful. Thank you, Claudia. And hello, everybody. Thank you for being here with us tonight. As Claudia said, we are very excited to be showcasing our platform to you today. Now, just a quick background on me. I am a myotherapist and Pilates instructor, as Claudia mentioned. Now, I started my own practice when I was 19 and I built it into a multidisciplinary practice, a Pilates studio, and then functional training, gym and group fitness classes. Now, what I found, as many sole practitioners will find themselves, is in the early days when you can't afford to hire a receptionist, you have to wear so many hats and it becomes really difficult to be able to give your patients your 100% focus because you are worried about getting your bookwork done, you're worried about your clients and making sure that you deliver the best service, but also trying to have a life outside of your business as well. So what we've essentially done is taken all of my experiences over the last 20 plus years and found a way to streamline all of the things that I found hard about running a practice, all of the things that I didn't enjoy doing and the things that I never had time for, and found a way to automate those processes. Now, obviously being a small business owner, I also understand how difficult it is financially for you when especially when you're first building your practice as well. So what we've tried to do is build a platform that not only saves you time, but also saves you money as well and helps to stimulate growth within your practice too. Now, the first thing I want to touch on is our pricing structure, because a lot of people, when they hear that we have a $0 monthly fee, think there must be a catch to the platform. So there is no catch. I'm going to run you through the pricing structure now. So we've got two membership types. There is one that is $25 per month, and there is one that is $0 per month. Now, contrary to what you would usually be used to, the $0 per month includes access to every single one of our features. That includes the online integrated payment gateway. The $25 a month plan doesn't have access to our integrated online payment gateway. That's why there's a fee associated with that. So the reason why we have $0 fee per month is because we make money from our SMS messages and our video consultations. As well as that, we've worked out an incredible rate with our payment processor at just 1.5% plus 25 cents per transaction. Now that means there are no monthly fees. There are no setup fees either. So if you've got an existing terminal, you're likely paying a monthly fee. If you've got an online terminal that you're using, if you're with PayPal or Stripe, you'll know that our fees are significantly cheaper than what you'd already be paying now. However, even though our rates are so cheap, there is a very small margin that we make on the payment processing, and that is how we can fund our platform. Now, the reason why we went with this model rather than having a set monthly fee, like most other people do, is purely because our platform is about trying to reduce your costs. But while we're trying to reduce your costs, we also need to have enough money to be able to run our platform as well. So even with tiny margins, we believe that we can build this platform to be sustainable long-term, but also give you all of the features that you really need to run your practice. There are no hidden fees, no other costs that you need to know about except a payment deposit fee, which is charged from our payment processor, and we do not make any commissions on that at all. So it's a 25-cent fee that you pay when payment is deposited. Now you can choose to deposit it once a day or once a week. It's up to you. That fee is only a one-off fee when that deposit is made. And your payments can be deposited into your account every 24 hours, as I said, as well. Okay, Claudia, I might just get you to keep an eye on anyone who's popping into the room late and just let them into the room. Beautiful, thank you. Excellent. So let me just prepare my screen share so that I can show you the My Appointments platform in action. All right. Now, can you all see my screen? If you can just type a message into the chat box and let me know that you can see my screen. You should see something that says My Setup Wizard. Okay, there's my little chat box there. Okay, everyone, Claudia, you can see my screen. We're good to go? Beautiful, excellent. All right, so the first thing I want to go through is showing you how user-friendly our platform is. Now, a lot of people don't use a practice management system because they're worried that they're not going to be able to manage or use the platform because they're not IT savvy. And the beauty is that you don't need to be IT savvy to use our system. Now, the beautiful, clean, simple design that you're seeing is all courtesy of Claudia. She's an incredible graphic designer. So she's made it really easy to follow so that you can make sure that it's easy to understand. Now, this is a completed setup wizard, but what will happen is if it's not completed, this would be blue. So you'll know to click this button. You fill in your details, including your hours, and then you'll go through and follow the rest of the setup wizard. So you'd set up any services you have, any products, setting up your reminder messages if you want to offer online bookings, customizing your invoices, customizing your intake form. If you're using Medipass, which is our HiCaps Medicare, DVA and WorkCover New South Wales payment processor, you enter your API key here, and then you can process HiCaps and the other services through our system. And I'll show you that one a little bit later. And then the last step is, if you want to offer online bookings, you just need to copy and paste this link onto anywhere on your website, and then your patients will be able to go directly to your website and book appointments through your website as well. Now I'm going to show you a couple of the settings as well. First thing I'm going to show you is the intake forms. Now you can set up intake forms here and customize the message that goes to your clients. Now this is what it looks like from the practitioner's perspective. So we've created the health history section here ourselves. However, if there's something in here that you don't want, if, for example, if heart disease is not related to the profession that you use, then you just click this X button and it removes it from the intake form. Likewise, if you want to add anything, you just click the plus button, put the name of the disease or the condition there, and then it adds it onto your intake form. Your health history, your surgeries, your medical medicines and supplements, alcohol consumption, smoking, exercise, and family history are all added to your form automatically. Now, if you don't want them, you just turn this button off and it doesn't show on the patient side. Now, here's an extra box that we added just to show you that this can be added by you as well. And then we've created a current complaint section as well. So if you don't want to use this, you'll just click no. But if you do want to use this, you can get rid of anything that we've added and add your own questions. But these are the typical questions that I or most practitioners would ask their patients when they're coming in for their first consultation. Now, if you're a naturopath or any other profession and you want to create an additional section that's a little bit more customized, you can also create a fully customized section here. So for example, you can set up something on the immune system, you type in your introductory text, your question, and then specify if it's a written answer or a yes or no question. So here's one that we've pre-populated. So it's the family history, and that's basically what it looks like on the client side as well. If you are HiCaps eligible, your services are, then you can request the HiCaps or the health fund details on the intake form as well. And then that will feed through to our HiCaps system as well. We've got a suggested consent section, but you can go in and fully customize that as well. And when you're ready, you just click view intake form, and this is what it looks like on your client side. So you can see that obviously we'll be collecting their personal information, which is all encrypted and we don't have access to once it's submitted. Emergency contact details. Now, referral source is a big one. You should be collecting this so that you know how your business is growing and therefore you know where to invest your money as well. Now, if it's somebody who's existing in our system, they'll type in family and friends and put in the client's name, and that feeds into our automated client retention strategies, which I'll show you shortly. This is the section that we've created for the health history. So they'll just mark any relevant sections to them. And then as you can see, you go through, you've got your current complaint, your family history, autoimmunity. We've got a section to upload test results as well. And that just will save you time because everything that they're entering into this intake form is automatically added into your client card to save you from data entry as well. Obviously their health fund information, and then they'll just click consent, and that then gets sent to you so that you can then review the file as well. Now, the beauty about this is that if you can send this intake form to your clients at the time that they're booking, and it's all fully automated as long as you've set that up, then it means that you can collect your data from your clients before they come in to see you. Now, the beauty of that is that if you've got a chance to review your client's file before they've come in, if they happen to be coming in with a condition that you haven't seen for a little while or you're not super confident with, it gives you the time to prepare for that consult. And the beauty of that is that when your client comes to see you and you've already got a history from them, the session itself will run so much more smoothly and you can ask more detailed questions at the time of the consult. But it does save that time, especially if you're a tactile therapist and you do hands-on treatment. It saves some of the time that you spend in the consult room so that you've got more time hands-on as well. And for me as a patient, if I've gone in to see a practitioner who's had an intake form that they've asked me to fill out before I've gone in, the fact that they have a sense of my history in advance just gives me this level of confidence that they've taken that little bit of extra time to kind of get to know me. And I just find that treatment tends to be a little bit more smoother as well. So that's the intake form feature. You can go through and customize anything you like here. You can add times that you want to block out, your video consults, your embed code is here, adding your services and products, shipping, and all that sort of stuff will be managed through this area. Now, I'll quickly show you the products section here as well. Now, what we're in the process of doing is getting a file from all the practitioner-only companies so that we can pre-populate our system. And I'll show you a little bit more how this will work a bit later. But for example, if you wanted to add the Metagenics Ultra Potent Vitamin C, it's a product that you stock in your clinic, then you'll just put the name of the product and then our system will populate, if we have that data from the manufacturers, the item code, the suggested RRP. You just need to enter your stock levels and then when you'd like to be notified. For example, if your stock levels reach 5, our system will send you a notification to say your product, you need to order more of this product because your product is low. And the suggested use will come from the manufacturer, again, provided that we've been given that as well. Now, if you allow your clients to reorder prescribed products, you just need to turn on this little button. And then what you do is you specify whether it's shipping, pickup, or pickup only. You pop your product weight in, which will pre-populate if we've been given the data for you. And that helps us calculate your shipping costs. And then you specify how often that product can be ordered before a consultation is required. Now, as most of you know, practitioner brands don't allow you to allow your clients to order the products whenever they want. They need to be prescribed. But in some cases, you need to limit the times that the patient can order the product without a consult. So that's where you'll adjust those settings here as well. Okay, and I'm going to come back to products a little bit later and show you how the product ordering system works. Now, client retention is super important for me. Why? Most people think that marketing is the biggest, most important thing that they require to build a practice. But if you don't have basic client retention skills, what you'll find is that you'll be spending a lot of money on marketing, which may or may not work. But even if it does work, if you don't have some really basic client retention strategies, you'll find that you're going to end up losing those clients. So we've tried to build in some client retention strategies to help you. Now we've got this little box here, which is going to be displaying some suggestions and ideas for you from a marketing perspective as well. And we've got this bulk marketing section, which is in development currently. Now the design of this will change a little bit, but just to show you, let's say you wanted to run an event about endometriosis and you wanted to target women in your database that are aged 25 to 45. You could go through and create a filter for that purpose. If you wanted to do a special promotion on any patient that's ever been to see you for back pain, or patients that have been to see you in the last 6 months who have spoken about back pain but don't have an appointment, or any patients that haven't seen you for a certain period of time, you can fully automate the bulk marketing through here. You'll give the campaign a name. You'll adjust your SMS message here. It'll show you how many people that message is going to be sent to. And then we'll give you some suggestions here on marketing that you can use in your practice to bring people into your practice as well, or to reactivate your old clients as well. And then there'll be a reporting feature so you can see how well that promotion actually went. Now, once those clients come in, if they're a new client, they'll show up on your new client list. Now, I think it's really important that when you've got any new clients that you do follow up with them after they've had their first visit at the very least, just to touch base with them and say, just checking to see how you went after your first session. Feel free to get in touch if you have any questions. So that's the suggested message that we've put forward, but of course you can adjust that. You want your clients to know that you obviously care about them, and I think it's important to follow them up after their first session as well. Now, we know that it's really difficult to make time to call clients, but I think in this day and age, it's also much more acceptable to send text messages. A lot of people prefer that over a phone call these days anyway. Same with any overdue appointments. If your clients haven't been in to see you for a specific period of time, then you'll see a list of all of the patients when their last visit was. Now, all you need to do is say send to all, or you can send it to a select amount of your patients, and then they'll get a text message with a link to book an appointment with you as well. And it's just a friendly follow-up to check in to see how you're doing. And if you need another appointment, feel free to get in touch. Now, we've also automated client referrals. If you want to nourish your patients and get them to continue to refer to you, you need to make sure you reward them for referring. Now, you don't necessarily need to give them a discount, but acknowledging the referral and making them feel appreciated because they are helping you to grow your business, I think it's really, really vital. And in my practice, even if it was a phone call or a text message that I sent to someone without a special offer, just to say, thanks so much for the referral. Thank you for helping me grow my business. Patients really appreciated that. And as a result, they tended to refer even more frequently as well. Now, we've fully automated this process for you as well. So what will happen is when a new client comes in, you'll just link them to the client that referred them. If they've filled in the intake form and they've mentioned that client's name, then it just need to click one button, then it adds them automatically onto your client referral list. And then you just click send selected. So there's no need to keep track manually of who referred who. Our system does it all automated for you as well. Same with any missed appointments, birthdays, etc. It's all fully automated through our platform here. Now I'll show you the My Appointments tab, which is our calendar. For starters, you've got this top menu here, and this is the same on every page, irrespective of which of our pages you are on. This will allow a two-way SMS function. This tells you how many credits you've got remaining for your SMS and video consultations. This quick add is for adding new clients or adding new appointments. And then you've got this notifications tab here. So here you can see there's been 3 orders received from this patients as well. Now, if a patient reschedules their own appointment, if you allow appointment self-scheduling, if somebody books an appointment, if they cancel appointments, if they've filled in their intake form, if they've ordered a product, all of that data goes straight into your notifications tab to make it easy for you to keep track of everything that's happening from your clients from their own app as well. Now, you can obviously toggle between months here. If you want to go to a specific day in your calendar, you'll just specify the date. Now, it doesn't matter where you are in your calendar. If you're a week ahead or 5 weeks ahead, you click on today, it just brings you back to today's date. And then you can change your view. If you want to view day view, then you just click on day view, and then everything you need to do is here at the click of a button. If you want to view by month view, then you can obviously see that there as well. Week view, it looks like this. I'll run you through the calendar itself in a minute. If you're in multiple locations, you can change your location just by clicking on this button. If you've got multiple practitioners, you can just change the calendars by clicking here. The other thing you can do is if a client calls and says, when's my next appointment, type their name in and our system will bring up the name of the appointment type, the dates, and then if they're ringing to reschedule, you can just click this button to reschedule, or you can click this button to delete their appointment as well. Takings will give you a report of everything you've made in a specific date range that you've selected, and then we've got a wait list too. So if any clients call you and you don't have an appointment, you can just add them to the wait list. You can specify their availability, specify which practitioner they want to see, and then you can filter it out as well. So if you happen to have a half-an-hour appointment available in your diary, you just click on the sort button, and then you would just go, all right, well, my nutrition consults are normally 30 minutes. I can fit a patient in for that. And then you can filter it out based on the appointment type as well. Now, in the actual calendar itself, so you see this little tick here, that means that the patient has arrived for their appointment. Now, when you hover on their name, you can mark them as arrived yourself. You can also mark them as confirmed it yourself if they've confirmed their appointments. However, the patients can actually check themselves in from their app too. Now, the reason why I designed this is because before I could afford a receptionist, if I was busy with a client and I was always booked back to back solidly, and then my next client came in and I didn't hear them, I would always be worried that they're sitting out there and they don't know that I know that they're there, and they think I might be in my room waiting. And there's always that awkwardness that happens when the patient doesn't know if you're there, if you know that they are there. So when the patient walks in, they just click a button and they check themselves in, and then you'll get a notification here to say that this patient has arrived, and you'll also get this little check button here. Now, we are developing two-way SMS, so if you want your clients to confirm their appointment, it is free for them to respond to the message, and then that message will show up here just with a Y saying that they've confirmed, and then the intent is that that will then automate the process for you. So when you see that C button, you know that they've responded yes to confirm their appointment as well. So sending the message, it will cost you 1 credit, which is between 11 cents and 15 cents, depending on how many you are purchasing. However, when they respond, that's obviously no charge at all for that one. Paid, obviously pretty self-explanatory. It means that I've paid for this appointment. And then you've got this little icon here, which is missed. And then you've got this icon here, which is cancelled. So basically we've automated the charging a cancellation fee. Now, every time a client goes to book an appointment with you, every single time they see your cancellation policy. Now, I think it's really important to highlight your cancellation policy, not necessarily so that you can charge it, but just to make sure that your patients realize that there is a cancellation policy in place. And in the event that you get repeat offenders, then you won't feel so bad about charging them a cancellation fee. I think most patients should be charged a fee. However, there's obviously times when there's going to be exceptions as well. But the way in which we've automated this is if your client doesn't show up for their appointment, you just click the missed or the cancelled button. Would you like to mark this appointment as missed? And I'll say yes. And then our system says, do you want to charge a cancellation fee? If you don't want to, you'll just click the X button here. But if you do, you'll just click, I'll do that again, sorry. So then you'll just click the invoice button. And then it brings up the invoice. Now, all you need to do is put amount paid as $0 and then click process. And that sends the invoice to your client to pay. It shows up on their app, and when they look at their appointment, they'll actually see a pay now button, which I'll show you shortly. However, if you're using our integrated online payment gateway and they have processed a payment through our system before, whether you've processed it or they've processed it, the card is actually stored encrypted on our payment provider's platform. We can't see it, you can't see it, only it's all fully encrypted, but because the card is stored on the system and the client will choose that and you can choose that as well, then you can automatically charge the cancellation fee to your client. So whatever your cancellation fee is, you'll enter it here. You'll select your payment method, and then you'll click process, and off you go. The invoice goes automatically to your client so that they see the invoice there for themselves as well. Now, if we are presenting that cancellation message to them every single time they book, then they're going to be expecting that you charge them a fee as well. And obviously, it's completely up to you if you choose to do that as well. Now, no matter what view you're in, when you're ready to process an appointment, all you need to do is click on the appointments, and then everything you need to do is located here within the system. So if you want to invoice, obviously you'll just click the invoice button. I will show you quickly also the HiCaps processing system as well, just so that you can see how easy it is to use. So all you do is you'll just put the amount of the consultation. You'll click HiCaps, you'll click process, and then it opens up an API or a screen through Medipass. Now, it's free to register with Medipass, and they don't charge you any fees, and we don't charge you any fees to process health fund rebates. So if you've got a HiCaps terminal now and you want to move to this system, it means you'll save your $25 per month fee, because this has no fees attached to it at all. Now, if you are eligible for Medicare, there is a fee to process Medicare fees. It's 22 cents. That is a fee that Medipass charges, not us, and that's paid directly to them. But once you click the HiCaps button, everything will be pre-populated through our system for you. So all of their health fund details, the service type, everything is pre-populated. All you need to do is click continue to payments. And then what happens is this screen will pop up saying you've got 15 minutes to process this payment, but it shouldn't take you that long. Basically what happens is that your client will get an SMS message. There is no charge for that. That comes through Medipass's API. And all they have to do is click approve on their phone, and that updates our system with the gap amount. And then you click process, and the rest can be processed through our credit card facility, or if they've paid cash, you just mark cash. That's as simple as it is to use HiCaps. So the difference between a manual terminal, and I've had one of those for quite a long time, is that you normally have to swipe, enter the type of consult, et cetera, the fees, and then, of course, swiping the card and all that sort of stuff. With this, you don't even need to physically see the card. You just need the card details, which the client can actually add on their intake form or in their account for you as well. So in terms of payment processing, this should save you between 3 and 4 minutes, not just HiCaps, but the credit card processing. It should save you between 3 and 5 minutes between each client. Now, if you are like me and you always book back to back, that is a huge time saver, because it means that you should be running more on time with the next client that comes in as well. What else is there? Start video consult. Now, if you offer online video consultations, we've made this process super simple. I'm going to show you how this works. So if it's a video consultation, you'll put that in your settings to say that Initial Homeopathy Consult is a video consult service. And then when you're ready to start your consult, all you have to do is click one button and it opens up your screen for you. And there's me there. And when your client joins the screen, you'll see them here, and I'll show you that shortly as well. There's no need to set up links. There's no need to do anything special at all. All you need to do is when you're booking your client is specify the type of service. And if that service is linked to a video consultation, then this button will automatically appear for you and you just have to click it. And also the same thing will happen on your client side as well. And I'll show you that a little bit later. So no need to worry about sending out links. If you want to book the next appointment, you'll obviously just click here. If you want to skip ahead a certain amount of months, say if you want to book the next appointment in 3 months, you'll just click apply. Our system will take you automatically to 3 months. You'll click continue, and then you'll click on the time and appointment is automatically booked. And now I'll just return back to today. And the booking an appointment is also really easy as well. You just need to click on an available time slot and then it brings up the name of the client. You just type in your client's name, put the appointment type, and then it adds it in there, or you can also add it through here as well. Appointment notes is the other one that you can do here. So right now we've got assessment, treatment, and recommendations. One of our features, which I'll talk about a little bit later, is to have this fully customized as well. Now, the intention with this is that when you tell your clients to do something, a lot of the times they forget, or you write it on a piece of paper and they lose it and they contact you and say, what did you tell me to do? If you recommend stretches or anything else, or if you've got a dietary plan, often your patients might lose things or you have to email them later on. What we've done is automated that process for you. So if you say, I want you to do XYZ stretches, or I want you to follow XYZ plan, all you need to do is attach that information here, attach the text here, and then click this button and it sends it straight over to your client's account. And I'll show you what that looks like a little bit later. If you're, all of their past history, by the way, is here for you to see as well. So then you can just copy and paste those notes into your treatment notes as well if you need to. But you can also get a quick glance of what you've done in the past too. Now, at the time, if you're a practitioner who prescribes products, if you're ready to prescribe a product, all you need to do is type the name of the product and everything is pre-populated for you. Now, if Metagenics recommends that you take this tablet once, 3 times a day, but you want your clients to take twice a day or 2-3 times a day, you can adjust it here so that the recommendations are customizable for that patient's specific needs. And then you can adjust the repeat. So if you've got a particular client that you've been seeing for a long time and you're happy for them to order this product unlimited or more times than others, then you can also customize those settings here too. And then all you need to do is click recommend to client. Now, once you've recommended it to the client, it's going to show up here as a recommendation for your client. You click save and close, and then that saves all of this data into your treatment notes. So normally as practitioners, you give your clients your recommendations and then you come back and then you've got to type them for yourselves. We've automated it so that you only have to do it once and it saves it into your client's notes for you as well. Now, the client's card looks like this. When you're ready to see your client's card, you just click on their name. And this is all the data that you can see for each of your clients. Everything you need, the phone number, sending them an SMS, rescheduling, booking an appointment. If you need to block your client for any reason, because you don't want them to be able to book their own appointments online, you just click this button and then they won't be able to book you online anymore. But everything that they've provided in their intake form shows up here for you. And then you can just go in and update any relevant section if anything changes as well. Test results, when they've added their test results, all you need to do is click on any one of these, click on any of the results. And then you can see here the blood work that's been uploaded in this case. All of their appointments, you can see upcoming appointments. Invoices will show up here. Now, the client has their own invoices, so you should never need to print out statements. But if you do, you just highlight this, click email, and a statement will be sent to your client with all of their invoices as well. And then all their treatment notes are here for you. If you ever need to email out your notes to your client, you can also easily do that by clicking on the email icon here or printing out their results there for you. So that's a quick run through of the My Appointments platform. There are quite a lot of other features that we haven't gone through. I'm going to show you now the client's side of the platform. And I'll just refresh my screen here. Now, as you can see here, this Join Console button has appeared. So this means that this client just needs to click this button. I better close that one first, because otherwise it's going to give you some feedback. But now I'm logged in as the client. Okay, so it's the exact same thing on the other side. That's all they need to do. Click one simple button in order to be able to join you into the same space as well. Now you can see here, this is a naturopathy console. the join consult button doesn't appear here, only because the button is programmed to appear only 15 minutes before the start of the consultation. Just so that you don't want your clients trying to join your consults when you're not there. That way it only appears 15 minutes beforehand. And once they click on it, it says your service provider will join you soon. If you're using our app, you'll get a notification to say that your clients actually joined the consult as well. Now they can see all of their upcoming appointments, all of their past appointments, including all of their invoices just by clicking on this button here. They can book an appointment as simple as just clicking one button here. They'll select their service type. It populates our system with the available appointments. They just click it. Again, your cancellation message is here. They just click confirmed and their appointment is automatically booked with you as well. Now, service providers, this is where the patient can log in to see a list of all of their service providers, all of their invoices and contact information for that service provider. Now, any recommendations you've ever made will show up as a history here for them, so they can easily follow based on when the recommendation was made. If you've attached any files, then the files will appear here, so they can easily access those files at any time. Now, when it comes to product ordering, all they need to do is go into their tab. Right now, we're seeing products that have been recommended by Jerry here. And all the client needs to do is click add to cart. And then when they're ready to check out, they just click their cart button. All of the details will be pre-populated from our system. They'll choose their payment methods, whether they want to pick up, add any special delivery instructions, click continue to payment, process the payment, and then you will get a notification on your side, it's practitioner side, to say that an order has been received. Now, this is what it looks like when an order has been received by the actual practitioner. All you need to do is click the process button, and then it gives you all of the details that you need, the client, all of the client's information. You can print this out. You put in your tracking details for that product. You click complete order. And then on the patient's account, all of that data gets fed through a notification to them, but then they can also track their order by clicking on this button. So it saves the hassle of them having to contact you saying, I've run out of X, can you send it out to me? And then you having to invoice. Everything is fully automated for you through our system here. Now, we do have a directory that we'll be launching soon as well. So the advanced search directory that gives patients the ability to connect with practitioners who specialize in certain conditions. Now, as a practitioner, you know that we're not allowed to say that we specialize in anything. So what we've done is call them areas of interest, but it means that we can help you connect with more of your ideal clients. So what will happen is if a patient goes on to Find My Appointment, that's the name of the other platform, then what they can do is do a search for a naturopath who's available at 2 o'clock on a Friday that specializes in treating endometriosis, for example. And that way we can really refine it and help you connect with more of your clients. When the patient is logged in, they can also manage everything themselves here. So if they've got new test results, all they need to do is click this upload button. And once it's uploaded, they click that button there and it sends it over to you and you get a notification to say that Claudia has added a new test results. Now, we've also added the ability to manage families. Now, this is Claudia's brilliant idea because she's an avid user of so many forms of natural therapies, as she said. She's got 2 children and her children see chiropractors and homeopaths and other professions as well. And so this became a way that we can really streamline the process, that she could log into an app and see all of her appointments for all of her children as well. So you can see here that her daughter Diaz has an upcoming appointment with Margaret for naturopathy. She can then click to pay the invoice now or wait until the time of the appointment as well. So it's really easy for your clients to be able to make their own payments. As I said, from the section here, they can check themselves in, they can pay or join the consult as well. So that's a quick run through of the My Appointments platform. I've really run through that super quick. So hopefully we've covered most things for you here. Now, Claudia, just confirming you can see my keynote presentation. Yep.
See you perfectly.
Excellent. All right, so that's a really, really quick run through, as I said, of the My Appointments platform. Now, the purpose of this webinar today was, one, to give you a quick demo of what we've built, to talk to you about our upcoming features, but also to get your ideas and your feedback and things that you want to see that's going to make your life easier as a practitioner. Now, it's really important for us to do that because obviously I've been in clinical practice for a long time and I've had a lot of different types of practitioners, different modalities working with me as well. But every clinic and or every different type of service provider requires something that's different. So it's really important for us to be able to continue to grow this platform so that we can make sure that it meets your needs. So if you do have any feedback or comments or suggestions on anything, please let us know at the end of the Q&A as well. So I'll quickly run you through the upcoming features. So the first one is that we are going to integrate with accounting packages such as Xero. We haven't done it yet because we need to make sure that everything is fully finished in terms of all of our reporting and all of our features in order for it to integrate. There will be a way for you to export the data and import data into any booking system, but it's going to take a little bit longer before we build an API so that the process is automated. For anyone that does reoccurring bookings, if you're booking in advance, we're going to have calendars where you can go and book, 5-6 appointments in advance as well. Classes, if you're running Pilates or yoga classes, or if you're running a talk, or if you're running retreats, you'll be able to manage them all through our system. That includes managing direct debits. It includes managing class passes. So once somebody has used 10 of their sessions that they've booked in for, then they can go in and purchase another one, but our system will work out how many they've got left, and they'll be able to monitor all of that through their app and check themselves into the classes through the app as well. Customizable treatment note templates, as I mentioned. So in that respect, you'll have a note template that'll show up for an initial, if you do a report of findings or a follow-up consult or an extended consult, you can customize them. So whatever you would normally fill out will show up there for you as well. And we're also looking at doing reports too. So for the tactile therapist, if you're checking range of motion, for example, or you're doing pain scales, we can take that information with each consultation and then print out a report and let them know how they've progressed along with their treatments as well. A patient journal. The intent of this is twofold. As a practitioner, when your patients come in, you've obviously got to take your subjective findings as well. So your client will tell you how they've pulled up after their consultation. The intent of this is that if they've got a journal where they can keep track of their own treatments, they can more easily follow exactly what happened with that treatment as well. They'll be able to see that 1 week ago, their pain was 9 out of 10, and now it's only 5 out of 10, for example. But the beauty of this is that they can then go share journal. That gets sent to you, and then you just click one button and add that information into your notes. It shows up as a journal entry from your patient in your notes, and it's saved there as in chronological order so that you can follow exactly what's been happening with your clients, and then you'll be able to filter out and only see their journal entry, for example, or only see your notes as well. The beauty of this as well is that when you're, especially for naturopaths and digestive therapists, if they're taking a prescribed product, then they can leave more detailed instructions in their journal and share it with you. And it allows you to give them a more personalized approach as well with their care too. We're building an online store. So if you sell any products in your store as well that are not practitioner only products, then you'll be able to have them show up via an embed code. So you'll just copy and paste a code onto your website. And then when your patients click that code, it opens up a store, and then everything is managed through our platform, the shipping costs, your inventory, everything is managed through the My Appointments platform. Prescribed product reminders. Now, often you will recommend products to clients and you'll say, I want you to take it once every morning, and you'll find that they might forget. So we're looking to build in an integration here where you will send reminders through push notifications, so it costs you nothing, to remind your clients when they need to take their prescribed medicines. Now, the purpose of that is twofold. One is that obviously it serves as a reminder, but two, if your clients are more compliant with your advice and they're following your advice, you're likely to get better patient outcomes. And with better patient outcomes comes obviously better results, which comes more referrals into your practice as well. Those patients are naturally going to talk about you a lot more when you've been able to help them too. All right, so that's a quick run through of that as well. Now launching, we are almost ready to go. We're waiting on some legals to get completed and doing final stages of stress testing. We're expecting to take on sole practitioners within the next 2 to 4 weeks. And then people that require additional practitioners on their system, will be taking them on board within the next 4 weeks. Now we're only launching with our $0 per month plan with the integrated online payment gateway for now. We're not launching our $25 plan just yet. There are no minimum fees. So if you're not someone who uses online payments very often, or if you've already got an existing terminal, you don't have to process X amount of dollars in order to be on our free system. But
when you are using our online payment gateway, you can request for payments upfront or deposits for payments upfront for appointments. If your client can't pay their invoice on that day, the invoice is there and they can log in and pay from their app or through their web login. But in order to have those features available to your clients or for product ordering, you have to have our payment gateway set up. It's really easy. It's a simple form. You provide your details and then you get approved, and that usually takes 24 business hours. We then add a code in and then you're ready to go on that as well. Frequently asked questions. Are there hidden fees? And I covered this at the start. So just a reminder that the only fees we have are for video consults and SMS messages. The more you buy, obviously, the cheaper that they are. Obviously, you've got your payment processing and that 25-cent fee for payment deposits. Now, if you're already using another platform, yes, you can transfer your data across. We are still testing this at this phase to transfer the data because every system exports data differently. So we're creating a more streamlined approach to make sure that everything you've got in your existing system can be uploaded into ours as well. The payment processing works really easily. You basically fill in a form. It gets sent to our payment partners. They approve it. We add the code into your admin panel, and then you get an email saying it's ready to go. When you're ready to process your payments, you click one button and process, and the invoice is sent to your client. It really does save a lot of time as well. HiCaps. So I touched on this earlier before as well. There are no fees to use HiCaps, but you do have to sign up with Medipass. And again, they've got no fees provided you're only using HiCaps and not their Medicare processing. Data is stored in Australia. It's fully encrypted. We can't see any of the information that you put onto our system. We can't see any information that your clients put onto our system either. We've also built in extra security factors, which we're in the final stages of doing now. And that is that if you're a multidisciplinary practice and you've got a naturopath and a chiropractor, and you don't want the chiropractor to be able to see the notes of the naturopath, then what you can do as the admin, the super admin, is you set parameters for what you want your sub practitioners to be able to see. And that is whether they can access reports, whether they can access the client files of other clients that are not their own clients, whether they can access the diaries, the appointment book of the other practitioners, whether or not they can export out data or add other users onto the system as well. We have a live chat available as well. Obviously, we've got email support and we've got a ticketing system as well, but you will be able to talk to us through live chat too. Okay, so that is pretty much it. If we have any questions or any feature suggestions, please let us know. We've already run through the fees, but if you've got any questions, please start typing them into the chat box. If you don't have questions and you're not on our waiting list, please go to myappointments with an S.app, click on the tab at the top that says waitlist, and then you'll see a little button that says join the waitlist. And when you click on it, you'll get a little box that shows up. You can see on the right-hand side, you just need to enter your details. You'll get an SMS message to verify your mobile number, and then you'll join the waitlist. And as soon as we're ready to go, we can just click one button, and then you'll get your login details so that you can log in and start playing with our system as well. So that is pretty much it. Have we got any questions, any feature suggestions? Please start typing away. We'd love to hear from you.
I've got a couple here for you, Anil.
Yeah, go for it.
So a couple of questions from Lisa. She asked, firstly, is there an expiry date field for products?
Expiry for the product expiry?
Yeah.
Yeah, no, we actually haven't built a product expiry, but that's actually a really good suggestion. So what we can do is build in an expiry date that you would enter into the system, and then our system will send you a reminder about when that product is due to expire. So I'll take that note down now.
I've got that one already noted. I think that's a great suggestion.
Thank you very much. Great suggestion.
Lisa also had another question about signing up with Medipass and how long it would generally take to implement.
Medipass haven't been the most user-friendly company to date, but the platform that they built is exceptional. It's worth the wait. What they've done is the sign up process is very quick. It only takes a few minutes to sign up with them. But in the past, you had to sign up with Medipass, and then you had to go to HiCaps and sign up with HiCaps. And then you had to tell Medipass that you've signed up with HiCaps for them to connect the two together. Now, thankfully, they've finally automated that process and they're in those final stages right now of completing that process. So what happens is you sign up with Medipass, you provide them all of your details, and then they automate the entire thing through HiCaps. So as far as I know, it's only a couple of days that it takes for them to complete that process, but it may take that a little bit longer at the moment because they're automating those processes so that you only sign up with Medipass and you don't have to go and sign up with both of them. So yeah, so they're pretty straightforward, but again, it might take a week to get it up and running while they're finalizing their new systems as well.
Couple more questions here. These are from Vera. Regarding the intake form, how do you start using the system with already existing clients? And is there a way whereby some of the data can be uploaded by the practitioner? Old clients would find it's very strange having to fill in the intake form.
The intake form is only sent to new clients. So when you upload your clients into our database, they're not going to be considered new clients unless you go into our system and click add new client. So every time you click on this button, you click on client and you enter their details into our system. That is what the trigger is to send the intake form to the client. So you don't have to worry about uploading existing data and then them getting that intake form. When you do upload their data, what they will get is an email that invites them to join the My Appointments platform. Now, because we've gone to so much effort to build an app, so we've got an app on iOS and Android for both patients and practitioners. So that's 4 apps we've built. We really wanted to make it as seamless as possible. And the easiest way for clients to book an appointment is not to go to your website. It's to open up their app and click a button and do it within seconds. So your clients that get uploaded onto our system will get an email to say, here's an invitation to join the My Appointments platform. It's not mandatory, but they will be invited to come along so that way they can upload any test results, or if you've given them any recommendations, or if you want them to order products, that they can fully manage it through their platform as well.
Another question from Vera in regards to client record retention. So under the law, we have to maintain records for 7 years after the last consultation, or for young people until they are 25 years old on top of this. The question is, how easy is it to purge old records?
Oh, it's super easy to purge old records. If you're wanting to delete them completely, when you go to your client list, what you can do is just click on last appointment. And what that does is it filters out when your client's last appointment was. Then all you do is you click on this button and it'll highlight all of those clients, and you click the delete button, and that's as easy as it is to purge all of those old files that haven't been in to see you as well. Now, you will be able to archive them as well, so that you can do it one at a time, but it is much quicker to just filter them out based on last appointments and then purge them nice and easily like that.
Another question from Ruth. Will you cover how to record prepayments for those on a program? So obviously that's something that's still in development, but.
So I didn't understand the question in this. Is this in terms of direct debits?
For those on a program, I'm assuming she meant if someone's purchased a plan.
Yep. So if it's an upfront plan that they're paying in advance, then that would just be treated like a treatment. So you would put in, whatever the plan is, what the cost of that plan is, and then you can process those payments, whether it's a deposit or whether it's the full amount. If it's a direct debit and you want them to pay every month, for that, we'll be incorporating those systems as well, but not until our classes and events feature is ready, because that requires some more customization as well. So did that answer the question, if I've understood correctly?
I think so.
Yeah.
Question from Ina, which I think you might have covered already. Will it be possible to import some data from other clinic management systems? So I think we did touch on that.
Yep. So we're in the stages of testing that right now. Because every system is different and the data that they store might be different to ours, it becomes a little bit tricky to make sure that you align all of the data. So we're just going through and trying to automate that as much as we possibly can, so that all you need to do is click on your settings, and then you'll click on import data, and then you'll specify what you're uploading. So if you're uploading your client's files, you'll just click on clients, you'll click browse files, upload the CSV, and then all of that data gets imported into our system for you. So it's really straightforward, but the challenge is making sure that we can create something that's easy enough for you to do it on your own without having to mess around too much with the existing file that you're exporting out of your existing system.
Question from Anne, overseas consults and payments.
Yep, you can process overseas payments through our system. They are charged in AUD. We can't charge as any other currency at present, but you can charge overseas cards through our platform. There is an additional cost to that, and we are negotiating that with our payment providers. But I think the costs right now are about 2.5% and about 30 cents per transaction, which is still significantly cheaper because most are charging upwards of 2.9%. I've seen some at 3.3%. So still cheaper, but definitely a little bit more expensive than what we charged for Australian cards.
Question from Lisa. Can you please confirm what the $25 per month includes again? And also, what is the best way to take payment for programs? And what would be the best way to process payment plans?
So if you want to be processing payment plans, you don't need to be on our $25 a month plan. You'll be on our $0 a month plan. So it gets a bit tricky here because you're getting less features with our paid membership. Now, the reason for that is simple. With our free plan, it's free because we make a very small amount on all the payments that are processed, and that helps cover our fees. So if you're using our payment processing, then you don't have a fee at all. You don't have a set fee. You just pay the 1.5% plus 25 cents per transaction. Now, if you're transacting over $100,000 per year, we've actually got room to negotiate with our payment provider on those fees as well. However, if you are processing any payments through our system, then you'll be on the $0 per month plan. However, if you do want to see the pricing differences, myappointments.app, you just click on this pricing tab. And then you can see here with the $0 per month plan, you get unlimited calendars. On the $25 a month plan, you only get 2 calendars, and then it costs you $11 each per calendar, or $99 per month unlimited calendars. Both take online bookings, both have online intake forms, both have access to the app, both have access to reports, both have access to the HiCaps processing as long as they're integrated with the Medipass system. You can manage products on both plans. The cost of SMS is the same on both plans. The cost of telehealth is the same on both plans. Obviously, extra calendars are free because they're unlimited on the $0 per month plan. And then on the $25 a month plan, as I said, they do cost. The payment processing doesn't apply to the $25 plan because when you sign up to that plan, you don't get access to the integrated online payment gateway. The only reason why you're paying that fee is because you're not using that service. So as a result, on the $25 plan, you can't get access to prepaid appointments or programs, whatever it might be that you're running. Your clients cannot pay their own treatments. They can't order any products. And they also, funds deposit doesn't apply in that case as well. So if you do process an invoice, it still gets sent to them, but they can't pay for it on their app. So on the $0 per month plan, you can access all of the payment processing. It's only if you don't want to use our online payment processing that you'd be paying that $25 a month fee. And obviously that $25 a month fee just helps us pay our expenses as well.
Lisa would like to know about gift vouchers. Have we nutted out a system for those as yet?
Not 100% yet. Me and Claudia have been talking about this a lot, Lisa, and I will organise to have a one-on-one chat with you as well. With the store that we're creating, we will easily be able to manage it. But when we were discussing just for yourself, we were thinking that there might be more people like you who only sell gift vouchers. And whilst it's really easy for us to implement that in terms of integrating it onto your website, it's just that it requires a little bit more customization and a little bit thought behind how it's going to look on the front end to the patients. So let's organize a time to chat about that and see if you do sell any other products and how you would want it to be displayed on the front end to the clients as well.
Question from Ina. Are we planning to introduce liquid herbal mix and compounding mix builder in the future?
We are absolutely planning to do that. And I have been on the verge of emailing Kerry Bone, Professor Kerry Bone, so that we can have a discussion with him. He's aware of the platform that we're building, and obviously being the godfather of herbal medicine, he's the best source for us to go to ask him about what we can do to automate those whole processes. So absolutely, we will be doing that, but it will be in our next phase of development.
Hilton would like to know if we have any plans to connect with drop shipping companies like Vitally or Oborn Health.
We are looking at that. We're in discussions for drop shipping at the moment. It is in our next phase of development, but we haven't worked out who will be using as our drop shipper or our wholesaler as of yet, but we are in discussions at present to do exactly that.
And Jeff would like to know if people can book through their website, because some might not want to use the app.
Yeah, absolutely. So when you're in your settings, all you need to do is click this embed code, and then all you have to do is copy and paste this code onto your website. It produces a little a book now button. And then when they click the book now button, it takes them to this page where they will specify who they want to see, the type of consult that they're booking in for. If you're in multiple locations, they'll obviously be able to change locations here. And then once they've put in the appointment type, it auto-populates the next available appointment, so they know when you're available next. Or if they're looking for a specific time, they'll just click on the date, they'll click on the appointment, and they'll click confirm. And that is it. Their appointment is confirmed with you. This box will show up to prompt them to download the app. And if in my case, I'm already logged in, so it didn't require me to log in, but they do still need to have a My Appointments account in order to be able to book appointments. Now, the reason why we did that way is because we're trying to create some additional safety barriers. So when a client books an appointment with you for the first time, they have to validate their mobile number. So that way we can at least put some security measures in place that people aren't just going to come and book appointments with you and not show up for them. We've verified their mobile number. We've presented them with your cancellation policy. If you require a deposit or a payment upfront, that can all be automated through our system as well. And then when they click on View My Appointments, it just takes them straight into there to log in to manage. But again, that's not mandatory that they use that.
Will there be a way to add in promotional codes? Beck's asking.
Yes, absolutely. It is also in our plans to do that too. So what we're intending to do with this is that at the time of invoicing, sorry, let me take one step backwards. On the intake form, there is a way that we've created a referral section. Now, I'll just show you that because it's easier to see it in action. But where you see the referral source here, what we're going to do is have a promotion. So we've got a promotion button here. If they click on promotion, there's no data that they can actually enter. So you don't know which promotion they've come from. But the next phase is that you can go in and customize this section. So if you've got a 10% off promotion, for example, you would click that here, or add it here, I should say. And then when the intake form comes to you, that 10% promotion gets added into our reports. And then you can run a report to say how many people heard about you through XYZ promotion as well. Now, at the time of the invoice, you can apply the discount. It'll be pre-populated in our system. So you'll go into, discount codes, for example, and you'll put in the parameters there, what the code is, if it's a percentage off or a dollar amount off. And then at the time of invoice, you'll just click one button and it pre-calculates for you what that promotion is. And then again, that gets added to the report. So you know how many people not just booked in for it, but how many people actually use that promotional code as well.
Jennifer would like to know if she charges someone elderly a discount, can they prepay a reduced fee?
That's a good question. We've built in, so on the client's card, you can have concessions, and that will eventually show up on your invoice as well, so that you can apply the concession there. I'll have to think about that one, Claudia. If you haven't written that down, please write that one down.
Yep.
When the client pays for the service fee is set. So we would have to add an additional logic that allows them to enter a code when they're booking an appointment. So it's not possible now, but yes, we will be able to do that once we've got our promotions and codes section running. The concession would apply in the same way, in that when they go to pay for it, if their concession is switched on and it's been verified on your end, then they'll be able to apply the concession. So we have thought about this, but the reason why we didn't add it in the first stages is it requires a lot more logic behind it, because if you've got a concession fee that can be charged to a client, it means any client could technically go in and apply that. So we have to do it on a customized level, so that when you add it into your client's file, it only shows up for a discount for those clients whose concession that you have approved as well. So hopefully that answered your questions.
Would like to know two-way calendar sync.
We have an integrated two-way calendar sync. We've got a section where you can provide your feedback for that, but if you could specifically let us know which calendars you want to sync with, that would be great. We're naturally going to sync with phone calendars, iCal and the Android version of that. It hasn't been developed yet, but it is in development as well. But if there's any other calendars outside that you want to sync with outside of those two that I've mentioned, please let us know so that we can look into the API functionality as well. Now, it does get a little bit more tricky syncing with calendars because there's so many more parameters around our calendars where you set your hours and that data needs to be fed somehow into your calendar. If you're only allowing one way, it's easy. If you want two-way, then that becomes a little bit more tricky as well. So we are looking into it, but we're not too far advanced on that one yet because we really needed to know feedback from people as to which calendars they may want to integrate with.
Good question here from Zena. What is the time limit for booking online? Question 1 hour before.
Oh, right. Okay. So when you go to book your online settings, you'll specify what your cancellation lead time and what your booking lead time is. So if you want 6 hours notice, that means that if it's, 12 o'clock in the afternoon and you've got an appointment available at 1 o'clock, your client won't be able to book that because you've specified that you needed 6 hours lead time. So that means that the first appointment that would show to your client would be 6 hours. And same with cancellation lead time, you would specify what amount of time your client has that they can cancel their own appointments as well.
Jeff asks, is there the ability to add a buffer between appointments, for example, 15 minutes for room setup, etc.?
We have thought about this, but we haven't integrated it. One, we wanted to know how many people require that buffer, but two, there are ways to manage it currently. So what you could do is when you're setting up your services and types and fees, if it's an hour massage, for example, you would just put the duration as 1 hour and 15 minutes. And what that does is it just naturally blocks out that 15 minutes for you. We are looking at the buffering system, but we really need to talk to someone who uses it to see exactly what it is that they require, rather than that blocking out that time, whether they would require it for every consult or only for specific consults as well. But the short way around that is, as I said, whatever the treatment consult length is, you could specify an extra 10 minutes or 15 minutes after each consult so that it naturally blocks out those appointments for you and doesn't allow your clients to book those during those buffer times.
Okay, is there a plan to have multiple intake forms? For example, motivation profile intake form as well as a standard form? That's from Hilton.
Yes, Hilton, not developed, but in the process as well. We're just designing that process at present. First thing will be that you'll be able to set the intake form based on the profession. And now we need to work out the logic of sending intake form based on service. So all in development, but won't be ready as part of our launch.
Love this question from Virginia. So is there a directory of business profiles for potential clients to find practice using this platform?
Yes, there is. Claudia, shall we do a quick demo of that?
Maybe just a tiny one.
We're really excited by this platform. Just give me a moment as I just bring up the file to show you that one. So it is in development. This one is almost fully developed, but we've put it a little bit on the back burner because we need to slowly take people onto our platform. We don't want to be inundated with thousands of people logging onto our platform and then us not being able to give, the best service possible to those that are using our platform. So we're going to slowly integrate people onto our platform. So that means that we'll start collecting practitioners onto our directory as well. And then we'll launch it out to the public sometime soon as well. So Claudia, just confirm you can see the directory now?
Yep.
So the directory is called Find My Appointments. Now I'll show you how that all works, but the first thing I want to show you is this acute care section. Now Claudia and I belong to a lot of natural healthcare groups on Facebook, and we're constantly seeing people putting up messages saying, my child has a fever, my child has a cough, I've fallen over, my head hurts, what can I do about XYZ? Now, a lot of the times the reasons why patients do this is because they don't have the ability to go in and walk in and see a practitioner whenever they want. They don't have an on-demand healthcare service the way they do in the medical fraternity. So we've built in an acute care section. So what that means is if you're somebody who's not doing this full time, or you've just had a baby, or you want to work outside of regular hours to be available, then you just go into your system and then you mark yourself as online. Now, what that does is when somebody comes to book an acute care consultation, it shows us here that Jack Lawson, who's a kinesiologist, or Eliza, who's a naturopath, are available right now for a consultation. Now, what we're building is the ability to filter. So if you're somebody who wants to see a naturopath, or sorry, if your patients are somebody who prefers to see a naturopath, or they prefer to see a homeopath, they can filter out their results as well. But the intention of this is that they can log on, and it could be any day of the week. And if somebody is available, they'll be able to book an appointment immediately on the spot. So the way this would work is that you have to be on our $0 plan with the integrated payment processing. When we collect the money, it actually goes straight into your account. It doesn't come through My Appointments into your account. It gets filtered directly from the payment processor straight to you. So you have to have your own payment processing in order to be able to facilitate this next process. But what will happen is that the client will come online, they'll say, I can see Eliza's available. I'll click book now. Eliza will get a notification to say that Virginia wants to book an appointment with her. Eliza will click confirm to say that she wants to take that appointment. Virginia then gets a pay now button. She pays for her appointment straight away. And then she gets the intake form and she fills it out. And that gives Eliza a little bit of time to start preparing for that consult. Now, as you saw with the video calling screen, it's literally just that, I've closed it down now, but it's literally just that one button that the client will join and the practitioner will as well. So it just saves the time of then having to send out a Zoom link or anything of that nature, because it's all fully automated through our system as well. So what that we hope that will do is start creating an on-demand healthcare service, but it also helps those practitioners who don't have enough of an income stream that they can do this full time. Or as I said, if they've had a baby and their husband gets home at a certain time and they can work from 7 till 9 o'clock, then they can mark themselves on as available, go about their normal lives. And if they get a notification that someone wants to book, then they can easily book that appointment straight off the bat. We'll be doing featured therapies, so we can obviously promote therapies, and then promoting the app for patients to download and book appointments through the app as well. Now, the way the directory works is that you basically do a search for a profession, location. You can filter out location as well based on how far you're willing to travel. You can search by condition as well as profession, and you can also search by services as well. Now, what you can then do is further refine your search. So if you're looking for an appointment on a specific date, you'll just click the calendar. If you're looking for a specific time, you'll enter the time that you're looking for, and then you'll apply more filters if you like. So for example, if I've done a search here for a naturopath, and now I'm looking for somebody who specializes in endometriosis, they'll type in the name of the condition. If they want somebody who does live blood analysis or GAPS or Vega testing or anything of that nature, they can also refine it by services. If they specifically want someone that does mobile or online or in person, specific gender, if they're looking for someone who's specifically available on Mondays because that's their day off, or if they're looking for someone who speaks Italian or any other language, they can fully filter it through our results, and then they'll click find my appointment, and then it brings up our results here. Now you can see here Danielle Sawyer is available now for a consult. So this is helping to fill those last minute appointments that are always the hardest to fill. And if someone sees that she's available now, they'll just click to book now, and then they'll just go through the process of adding the reasons for their consults, any additional notes, and then that data gets sent to you to approve. If they're wanting to book a future dated appointment, they just click this button, they'll confirm, they'll get that booking screen again. If they're looking for more information about you, they just need to click through to your profile. You'll see here that all of your social media channels, your website, your phone number, everything is here for them to go in and inquire and find out more information about you. But we've built this in such a way that we're expecting that patients don't need to go back to practitioners to ask questions. Everything should be here for them to confidently book an appointment on the spot. Now, we know that 62% of people book appointments outside of usual trading hours. So there's a lot of missed opportunities if you don't provide the information to your clients that they need to book the appointments. Now, if you're a sole practitioner, you don't have a receptionist, and they've got a simple question like, are my services eligible for private health insurance? By the time you get back to them, there's that missed opportunity. Often it takes them longer to get back to you, and then you've got to follow them up, and there's missed phone calls. So if we can provide them with all the data they could possibly need to confidently book an appointment on the spot, then we expect that this is going to significantly increase the amount of bookings that are happening online. But however, they can contact you if they wish. You'll see that Danielle's availability is scrolling with me so that it's always there at the click of a button to book an appointment. You've got the About Me section. If they're a member of an association, we'll show the logo plus the association's name. Now, this is where you define your specialty areas. Again, we've called it areas of interest just to keep the Health Complaints Commissioner and AHPRA happy. Additional services, you can put some photos of your gallery, of your clinic. Even if you work from home, you can put, some basic stuff, but it's not mandatory. But we always recommend putting photos, because anything you can do that's going to increase your client's comfort level is always going to be a bonus for them walking in your door. If they know where they're going, if they know what your practice looks like, if you work from a home, for example, and you put a picture of the front of your house, it just makes it easier for people to know that they're at the right location, et cetera, et cetera. Your hours, your pricing, any additional services. And then this frequently asked questions is self-populated. So whatever you typically would get asked, you would populate this so that all the information is here for clients who want to book your appointment. So what we really believe is that this is going to help connect more patients with their ideal practitioners. And the reason why we've built it in this manner is because I'm sure most practitioners would see this as well, but certainly something I've noticed hugely over the last probably 5 years. And that is that patients come to you with their own self-diagnosis. So as a tactile therapist, they'll come into me and say, I've got carpal tunnel, or I've got wry neck, or I've got sciatica. Now, in most cases, they're wrong, or they've got the symptoms of those conditions, but it's probably just a trigger point that I can easily address. But with the ingestive therapists, they'll get people coming in and saying that they've got this condition or that condition, and people are just more savvy with knowing what's going on and Googling and trying to self-diagnose themselves as well. So what we've found is that because people believe they know what they want, they're now looking for practitioners that are going to fill that gap for them. So if they think they've got endometriosis and it happens to be something that you specialize in, then they can go and find you. And it doesn't matter where in the world you work. If you're on our platform and you offer online consults, they can now start seeing the type of practitioner that really meets their specific needs. And it also means that you start filling your diary with more of the types of clients that you like to see. I became known as a bit of a headache and sciatica specialist. Just naturally, somebody came in with headaches and sciatica and I helped them, and then they told other people who had the same conditions. And so I naturally started finding that I was getting more of those types of clients as well. And that's what this system is intended to do, to bring you more of the things that you're best at doing. Now, we do have reviews. You can switch them off if you want, but you can basically transport your existing Google reviews on here as well. You won't be able to put your Facebook reviews. Unfortunately, it was too complicated to do both. So we've opted for Google reviews, and we'll also collect reviews from clients as well. Now, the reason why we've done this, it's quite contentious to have reviews for natural healthcare practitioners. But when we looked at the data, 92% of people trusted a review as much as a personal recommendation. Now, anyone who's been in clinical practice long enough knows that a personal recommendation, that client in the vast majority of cases is so much more compliant and has so much more trust and faith in you because they've got some sort of a connection with you. Somebody's spoken highly about you. Someone's told them how much you've helped them. And so it's created this immediate connection and trust. And that's what this is designed to do, is to create an immediate trust so that they get to know you. We've got this about section as well. And we want this to be really personalized, because then we're helping patients develop a connection with their practitioner before they've met them, which allows for better patient compliance and more trust when they're walking in the door. So again, you can switch them off, but we do recommend keeping them on. Now, the next question is going to be, for sure, how much is this going to cost? It's free. For the first 12 months, there are going to be no fees at all to use the Find My Appointment platform. We will have featured listings. So if you want to stand out above anybody else, you will be able to pay so that your services stand out above anyone else in your same area. But otherwise, it's going to be based on a first come, first served basis. We may keep it free forever. We don't know. We'll see how My Appointments goes. But the intention is that we're trying to not only help you manage your practice, but also to bring patients into your clinic door as well. All right, Claudia, we're nearly at 9 o'clock. Any last minute questions?
I think I've got to everyone. If I've missed anyone, please shout out now. Anyone that I've missed? There's a lot of agreements here about the buffer, so that may be something that we really need to look at.
Perfect. And if anyone is listening on that buffer note, let us know if extending the length of the consult solves that problem for you, or if having a buffer creates some other parameter that makes life easier for you, because that's the part that we haven't wrapped our heads around yet, how having a separate buffer versus extending a consult and blocking that time out, because the client doesn't see that. They don't see that you've booked them in for an hour and 15 minutes. They will see that you've booked them in for an hour. They can't see that time, that buffer time that you've allowed. So if there's anything that our current system doesn't achieve, please let us know. You're also welcome to send us a message, an email through hello@myappointments.app. Please go and follow us on LinkedIn, Facebook, or Instagram, and you can also then connect with us through those platforms too. Wonderful.
Yeah, I think that's it. Another comment from Lisa about the allowing a 30-minute buffer. So we'll definitely get to that. Any charges for text messages per message or in bulk? Charges for text messages, sorry, per message or in bulk.
You purchase credits. Minimum purchase is $20, and that gets you about 130 credits, I think it is. So you pay for the SMS as you use them. So they get credited as you use them, I should say, but you need to buy them a minimum of $20 at a time. If you buy them at $20, then the messages cost 15 cents each. If you buy them $100 or more, then the messages drop down to 11 cents. If you're sending bulk marketing messages or you've got lots of clients, we do have room to negotiate on those as well. Excellent. All right. Well, we've gone for a lot longer than what we expected, but lots of questions, which is fantastic. If anybody has any suggestions, any features, anything that we can build that's going to make your clinic life easier, please connect with us either by email, through Facebook, LinkedIn, or Instagram. We would really love to hear from you, and we're happy to organize one-on-one meetings to really nail out exactly what it is that you want us to achieve for you as well. So thank you everybody for your time. We do appreciate it, and thank you for sticking around for as long as we've gone tonight. It's wonderful to have you here, and we will be in contact soon.
Thanks everyone.
Bye.
Bye.